Hello, my name is Schőlin and I'm presenting on behalf of the team listed on the slide here, and I'm going to be talking about our study on prevalence of alcohol-related injury across 3 hospitals in rural Sri Lanka. So we do know that a large proportion of alcohol-related injury are caused by alcohol-related harm is caused by alcohol-related injury globally, and we know that in Southeast Asian region the harm per liter of alcohol consumed is very high, despite a high proportion of abstainers in the population. And international research has suggested that on average across emergency departments, about a quarter of injuries are alcohol related, but that can be higher in some countries. But the information on prevalence of alcohol-related injury in rural Sri Lanka is limited, despite a lot of social and health problems related to alcohol, particularly consumed from cheap illicit products. And the aims of this study were to determine the burden of alcohol-related injury in a hospital-based sample and explore factors associated with an increased risk of an alcohol-related injury. So we recruited adult patients admitted as inpatients across 3 hospitals in the North Central Province and collected data between May and November in 2018. Information about the injury was assessed using a tool developed by the Ministry of Health, and alcohol was assessed firstly with the audit test for chronic alcohol use or current drinking over the last 6 months. And acute alcohol use was assessed using a breathalyzer. Patients with a breathalyzer reading that was equivalent to a blood alcohol concentration of 10 milligrams per deciliter was considered to have had an alcohol-related injury, and this is in line with previous studies. And the analysis is listed on that slide. 833 patients were eligible and consented to take part in the study, and this included patients where we had both a breathalyzer and an audit sample or a score. The prevalence of alcohol-related injury was 15% among all patients, and among current drinkers, this was over 30%. In the sample, 44.8% were current drinkers. Patients with an alcohol-related injury were primarily male. There were only 1 patient who was not male. And as you can see from the graph, audit scores among patients with an alcohol-related injury was significantly higher than those who did not have an alcohol-related injury. Factors associated with an alcohol-related injury were age, and we could also see that intentional injury were more likely to be alcohol-related, with lower odds for other occupations compared to some other occupations, and transport injuries more likely than some of the other types of injuries like plant sting or animal bite or mechanical injuries. So the conclusion is that we've demonstrated that among current drinkers in this region, 1/3 of injuries are alcohol related, and tackling problem drinking in men could reduce the burden of injuries in this region of Sri Lanka. Thank you.